Good day, my name is Andreas Hackertal and I'm a gynecologist and I'm a practitioner working in an ambulatory day unit which is located in Hamburg in Germany. We formerly were known as the Tagesklinik Altonaer Straße, and we changed place and changed the name to Frauenklinik an der Elbe. We are a center with 9 gynecologists and a couple of anesthesiologists. We mainly do surgery, and we are an endometriosis center, a certified endometriosis center in Germany, and have quite a bit of endometriosis patients, around 800 per year, that we treat, and very often with surgery. So there are a couple of questions being asked, and one of the questions is if patients with endometriosis have wind problems, and whether that might be a symptom of endometriosis, especially if the bowel is infiltrated, and what we could do against it. So I believe that typically the flatus or the wind problem is not associated with endometriosis. Saying that, I know that infiltrating disease, what endometriosis is, it has numerous symptoms which mostly are dysmenorrhea, dyspareunia, which means problems during menstruation, pain during menstruation and during sexual intercourse, dysuria, which is pain during avoiding, and dysgeusia, which is pain during stool. So typically flatus might be associated with endometriosis. However, in a disease that is interdisciplinary in the sense of a patient never presents with typical endometriosis symptoms, but rather with symptoms that might be associated with endometriosis. So I believe our duty as gynecologists is to rule out or to diagnose endometriosis. And therefore we have different diagnostic tools like ultrasound, palpation, examination, and surgery. And if it comes down to endometriosis of the bowel, so endometriosis typically is an inflammatory disease which may or may not infiltrate, and if it infiltrates through the layers of the bowel, then it might cause bleedings, because if it infiltrates into the mucosa, which is the inner lining of the bowel, then there might be blood on the stool, which is totally rare. We hardly see that. We see endometriosis infiltrating the outer layers, which is the muscle layer of the bowel. That is not very uncommon, but we hardly see that it really infiltrates into the mucosa and into the bowel. And therefore, the question of does endometriosis cause wind problems or flatus? Probably it does not, but that is something that we have to rule out by doing the diagnostic tools I just mentioned. I believe if that is a problem, we have to look for disease of the bowel, we have to look for allergies or for gluten or other disease where patients just don't tolerate these kind of substance or the stuff they eat. So nevertheless, in these cases it would be useful to have a coloscopy, have a gastroscopy, associate, which is in endometriosis quite common, or go the interdisciplinary approach and ask the colleagues to see whether the flatus is coming from another perspective.